How do you define anxiety?
Just fear. It's just a phobia. That's all it is. I know that this is all in my head. I just need help.
Well, let's define all in your head. What do you mean when you say all in your head?
Like, I know I can eat that food, but when it's right in front of me, the fear is so real, I can't do it.
You say you know you can, you just think you can't.
Right.
And I don't think that's true.
Like, the test says that I can eat the food, so why can't I eat the food?
The test says that you won't have an allergic reaction to it. But listen, let me unpack this for you. For every thought you have, there's a physiological event that goes along with it. And your internal dialogue right now is horrifying. Your internal dialogue is that the world is full of things that will kill you if they get inside your mouth.
Correct.
Walking through a grocery store for you is like going through a house of horrors. So why is this happening to you? The vaccination was just one event that created a physiological reaction. You are having a lot of anxiety, and you said it's just a phobia. I have the opinion that there's only one phobia, and that's a fear of losing or being out of control. When you had that injection and you started closing up, you felt out of control. And it scared the bejeebers out of you. Now, anything that makes you think that's going to reoccur brings back to you, almost in a PTSD fashion, that you're going back into that loop of being out of control. Now, you were out of control when you were 6 or 7, and you got in a bad situation then. You didn't have the power or control to change that. When you got raped by a friend who then puts a cigarette out on your chin, you're out of control in that situation. You physically don't have the ability to stop the events that are going on. There has been trauma in your life where you have been out of control, and you hate that. You absolutely hate that. You have this fear of something starting and running away, and you don't have the ability to stop it. That's why you carry 3 EpiPens. That's why you call him 85 times.
Not anymore.
Because you have this fear that you can't control what's happening. Vanessa, what I'm telling you is, I think you've had trauma in your life when you were out of control. And near as I can tell, that trauma's never been resolved. I mean, no. There's never been anything done to heal those wounds.
No.
This is a complex and layered situation, and if you treat just the eating aspect of this, then one of 2 things are going to happen. It's going to come back, or it's going to express itself in another way if you don't deal with the cause, if you don't deal with the underlying trauma.
Just tell me what to do, and I'll do it.
I want to introduce you to somebody right here. This is Dr. John Caldwell. He's the medical director of Meadows Behavioral Health. They have created a unique treatment program solution that is built on their unique expertise to treat complex patients. Now, Vanessa will have the benefit, if she chooses to, of the Willow House program specifically for women. She will have a variety of trauma treatment therapies, and they will also tap into their program at Ramuda Ranch, which specializes in women's eating disorders, because it goes along with everything that we're talking about here. Now, I asked Dr. Caldwell to come here because they specialize in 2 things: trauma and eating disorders. And I believe that you have an eating disorder secondary to trauma. Dr. Caldwell, this is a highly intelligent, motivated individual that is a perfect fit for your protocol. Would you agree?
Yes, I agree. I agree completely with Dr. Phil that the approach needs to be sort of a dual approach where we have to give you the skills and the tools to be able to manage your current situation. At the same time, we need to help you to work on those underlying issues. we can help you in your journey for healing.
That's our plan, and that's our gift to you.
Thank you so much.
Okay? All right?